973.
Let's stay with the implications of this ambulance crew strike and bring into the conversation Health Secretary Steve Barclay, who joins me now. Mr. Barclay, we hear from the nation's biggest ambulance service, the LAS, that the public are only to call ambulances in the most dire cases of emergency of life and limb. Were the legislation that your senior colleague Grant Shapps is putting through the House, were that in place, what provision of ambulances would there be on a day such as today? Good morning.
Good morning, Nick. Well, it's about looking at what they do in other European countries, and in France, in Spain, in Italy, they do have minimum safety levels to safeguard core services. Particularly, I would expect that to focus on the Category 1, Category 2 calls, so the emergency Category 1 and the urgent Category 2 calls. So those are the areas you'd particularly look with minimum service levels to focus on. But of course, we would, as with any legislation, have quite detailed discussions in Parliament.
But the unions say they're covering those calls
apply.
anyway, of course, Secretary of State, don't they?
What, sorry, say again?
The unions say in dire measures, and there is proof of this, that they are covering the most extreme calls anyway. They will break the picket line.
Well, we were still having discussions through to midnight last night. I was still getting updates up to midnight because unlike the RCN, who did agree early national what's called derogations, national agreements as to the minimum service they would provide on strike days. Unfortunately, the ambulance unions have refused to do so and have insisted on having local arrangements. And of course, that makes it much more difficult for the government to put in place contingency measures to protect patient safety on strike days. So that's why we're looking at the legislation as a safety net to say what do they do in other European countries to safeguard minimum service levels, and what can we learn from that to ensure that we respect people's right to strike. That is important, but at the same time we do so in a way that enables appropriate contingency measures to be put in place on those days. And I think part of the concern is the fact that when you have lots and lots of local arrangements as opposed to a national agreement, then it becomes very difficult to put those contingency measures in place.
You talk about minimum service levels. Perhaps I can direct you to the front page of one of the newspapers this morning, The Times, and they've looked at figures from the ONS. 50,000 more people than normal died over the past 12 months, with NHS delays blamed for one of the most deadly years on record. If you exclude the first 2 years of the pandemic, 2022 brought the highest excess deaths total since 1951, all on the Conservatives' watch. How would you defend this fatal failure?
Well, if we look at it, firstly, I've been discussing, as you'd expect, Nick, this very closely with the Chief Medical Officer, with the NHS Medical Director, and the points they make to me is, firstly, it's extremely difficult to disaggregate what is the cause of that excess mortality. We knew during the pandemic that many of the measures that were taken, which were necessary to avoid further deaths as a consequence of COVID, would have an impact on excess deaths. So, for example, people being delayed in the treatment that they received during the pandemic, operations which have taken longer. There's a big backlog, as you know, in terms of people waiting for their operations. That has an impact. We're particularly concerned around the 50 to 64-year-old age group in terms of cardiovascular conditions, where perhaps people haven't had their statins, they haven't had some of their prevention as a consequence of the pandemic. There's other factors as well in terms of the delays that people have faced. So there's a range of factors, and we're not alone in this. All countries across Europe are facing a very similar discussion in terms of the consequences of the pandemic in terms of excess deaths.
Never mind too much other countries, respectfully, Secretary of State. This is, excluding the pandemic, the worst year since 1951, and figures published yesterday showed the third consecutive week and more than 1,000 excess deaths in England and Wales, and showed last year was one of the highest death totals in Britain ever recorded outside of the pandemic. On the Conservative watch, what, for the love of God, has your party been doing for the last 13 years with the NHS?
Well, what I'm saying is we don't accept those figures. I think
you don't accept
they
ONS
came in
figures.
yesterday. So no, the point is we're looking at those figures in terms of, for example, when you say over a 50-year period, obviously there's been very significant changes, both in terms of the demography, the numbers within the population, but also the type of conditions that people have. We have a much older population, people with multiple conditions, much more so than
They have
in the
old
past.
people in France, Secretary of State.
Indeed, and that's my point. That was my opening point, Nick, that actually in France, across Europe, there is a very similar debate. It's something, as I say, I've been discussing with the Chief Medical Officer and others in terms of the fact that as a consequence of the pandemic, we know that people had treatment delayed. We know some people are still being delayed in terms of treatment where they're on waiting lists, and that has an impact in terms of excess mortality. But that is something that's very complicated in terms of getting to the core causes.
Can we clarify one thing? It was reported yesterday that you said NHS staff need to, quotes, justify a pay rise through more productivity and efficiency. That was characterised by some as you telling them they need to work harder. A, did you say that? Did you say it? B, if you did, would you wish to apologise or retract it?
So firstly, Nick, no. And
no, you didn't say it, or no, you don't wish to apologise?
Well, no, I didn't say it. And interestingly,
right.
The person that made those remarks, the National Lead Officer for Unite, who was stood outside the Department of Health immediately after the meeting that I had with the trade unions, he wasn't actually in the meeting, Nick. So he was stood outside the department commenting on comments he was claiming that had been made when he was not physically in the meeting on which he was commenting. And the person that was in the meeting, Sarah Gorton, for example, who is head of the NHS Staff Council, described those discussions as making, quotes, progress. So we had a constructive discussion. Unfortunately, we did have one union leader outside who hadn't been in the room claiming what may or may not have happened, but actually the people in the room said there was a constructive discussion. We want to work with the unions in terms of this coming year's pay review body to reflect the fact that the NHS is under very significant pressure, to reflect the fact that we want to get the balance right between what is affordable to the wider economy, what is affordable to your listeners who have cost of living pressures in their own jobs, and what is right for the NHS given the pressures that it faces. And we have the pay review bodies independently to make those judgments, and we want to work with the unions in terms of the evidence we submit, particularly on, for me, in respect of health.
Secretary of State, there's been a lot of publicity about the possibility of a so-called one-off payment in the realm of, say, £1,600 or whatever on an average salary, possibly being a way of solving the dispute. Can you confirm that's one of the issues on the table, one of the suggestions on the table?
Well, the Prime Minister said at the weekend that nothing was off the table, and we as ministers, and not just myself, but the Education Secretary, the Transport Secretary and others have been having further discussions with the trade unions. And it's right in terms of this coming year with the pay review body process, which will apply, obviously the financial year starts from this April.
Yes.
That instead of focusing
It's only for the next financial year we're looking at then, just to clarify.
Well, it's for this financial year has been the focus, but obviously as part of the meeting, the trade unions made representations in terms of this year, and I listened to that, and I will discuss that across government with my other colleagues. Obviously, the Education Secretary, the Transport Secretary, and others are having very similar discussions.
You referenced the Prime Minister's interview on the weekend. Can I ask you, do you have private healthcare, Secretary of State?
I don't subscribe to a sort of a GP private thing, but I don't have a problem if people with their own money want to.
Sorry, a GP private thing. What does that mean?
That private subscription. So no, I don't subscribe.
You just have NHS care.
So yes, I don't subscribe to private provision, but I don't have a problem with people with their own money who wish to spend that money on private healthcare. I think that's a perfectly reasonable thing for people to want to do. As
you are in receipt of NHS care, I wonder how do you respond if your treatment was delivered in a hospital car park porter cabin?
Well, again, this is a complete mischaracterisation of
so there aren't any of these demountable or porter cabins being put into car parks?
If Nick, you just let me answer.
Please do.
So firstly, what we announced on Monday was a £250 million to reflect the fact we've seen a sevenfold increase in just a month in the number of flu cases admitted to hospital. There's 100 times more patients with flu in hospital this time compared to the last year. So there's been a significant increase in pressure. Of course, that comes on top of COVID cases, more than 9,000 patients in hospital with COVID. So we've listened to the concerns in terms of that surge of pressure. What we announced with the £250 million is further modular capacity. We will give trusts discretion. Some may wish to use it to help free up those in hospital who don't need to be there to be discharged more quickly. The delayed discharge, there's around 13,000 patients in hospital who don't need to medically be there, so we're keen to free that. That in turn will unblock the emergency department, get flow into the NHS. But one of the other things we're offering is modular capacity in terms of the emergency department itself. And that is something clinicians have said to me that they want to see, that they've welcomed. That's what we worked on over the Christmas period. And if you look at the quality of modular, I think it's a real mischaracterisation to say that in some ways this is low quality buildings. Actually, the quality of modular provision now is extremely high.
Finally, are you the man to bring about peace in this issue? You'll be aware that Alistair McClellan is the editor of the Health Service Journal. He wrote upon your arrival in post, "Never has a politician arrived in the post of Health Secretary trailing a worse reputation among NHS leaders than Steve Barclay." He described you as the Health Service's worst nightmare. Pat Cullen from the RCN, she said you're, quotes, "a bully boy." Are you part of the problem, Secretary of State?
No, and it is rather odd from Alistair to make their comments before I'd even done a day in the job as Secretary of State. So that was a slightly odd thing. Of course, my previous role was as Chief Secretary, and as part of Chief Secretary, your role there is to look at finance across the government as a whole, and traditionally that is a challenging role. And traditionally
why are you
that's
unpopular?
the case. But my job is to make the case for the NHS, to make the case for health workers. That is what I will.
But is it your stewardship of the
doing.
purse strings that makes you unpopular, do you imagine?
Well, a chief secretary, by their nature, often has to be the one pointing out what is affordable to the wider economy. I don't think that, Nick, is any secret. That's applied to all chief secretaries that have done that role. I don't think that's a personal thing. I think that can be said of pretty much all chief secretaries, that often they have to be the ones pointing out some of the financial constraints. But my job as health secretary is to make the case for the NHS within government. I do that very clearly with my colleagues, but of course we need to have those cross-government discussions, and the Education Secretary, the Trade Secretary and others ministers will be doing exactly the same.
Appreciate your time this morning. Very busy day for you. Thank you, Health Secretary Steve Barclay, appearing here on LBC 2 minutes after 8. Let's get the news.
On your radio, on Global Player and
Play LBC.